This one was interesting. I saw this article pop up, and then I saw a bunch of people talking about it on social media. And so I want to talk about it, but I'm going to talk about it for kind of a different reason than maybe the thrust of the article. So this segment comes from a recent $15 million fine paid by 3 hospitals and medical groups in Houston. It was Baylor St. Luke's Medical Center, Baylor College of Medicine, and Surgical Associates of Texas. And the topic that I want to talk about is it possible that an unqualified surgeon may be operating on you without you knowing? And the reason that this is tied to this big,
So that's scary.
It is and it's not. So that's what I want to talk about, because when this story kind of landed, here, throw up the article. This is the article that I was reading. Yeah, Texas Medical Institution agreed to pay $15 million. So this didn't necessarily talk about it in the title, but when you started reading this article, it went into the details. It started from a whistleblower in 2019 that said 3 heart surgeons were each running 2 different OR rooms and was delegating key parts of the heart surgeries to unqualified medical residents. And so, of course, like when social media saw that, there was kind of this outcry of, how are they letting unqualified people operate on you? Mm-hmm. And of course, this is just wrong, like when it says medical residents. And what I mean by that is, when you say someone's a resident, that means they have a certain amount of training.
Yes.
All right. The people that work with cardiothoracic surgeons are not residents, they're fellows. And so there's a really, really big distinction in that. And I want to kind of go into that because I think that there was a lot of fear generated from these articles talking about this judgment that probably is not warranted. Because I do think that the way that the article is written, and I probably should have pulled up the excerpt that had that said unqualified medical residents, that's just absolutely false. It's absolutely incorrect. So obviously there was an issue with the billing with these groups because there was a fine paid out. $15 million is pretty significant. Most likely what happened is they were billing incorrectly, probably billing for being present for a whole surgery when they were only present for part of a surgery. And since I don't bill for that type of surgery where I have somebody under me, I couldn't tell you the exact specifics, but there are certain guidelines for how you bill that. Mm-hmm. And when you're dealing with the government, with Medicare, they don't fool around. If you do it incorrectly, they will slap you. And this is a classic example of that. And so, as I said, I want to talk about the resident part because when I saw that and people were freaking out, I'm like, this is normal, okay? It is very, very normal if you're in a teaching hospital that your surgery may be done by a resident, and you may or may not know that.
Yeah.
Now, all of these teaching facilities do have to declare that they are a teaching facility and that there is a chance that you will be seen or treated by a resident doctor or a doctor in training.
Yeah.
In fact, the trauma hospital that I work at has residents, and I see they have little posters up everywhere that says, this is a training hospital, this is a teaching hospital, you may be treated by a resident.
Right.
And so I want to go through like the different levels of residents, and eventually I'm going to tie this back to the story and talk about, okay, if you have a doctor in training, what does that mean? Like, what does their level mean? Because, there's a lot of words thrown out there: intern, resident, fellow. I mean, you guys have heard those terms, right?
Yes.
Do you know what they mean really?
I'm guessing an intern's pretty low.
Yeah, that's going to be the lowest for sure. Yeah. So you're right. Interns are the lowest. So the way that we classify residents oftentimes is by PGY level. So that's postgraduate year. So like a PGY 1 is an intern.
Okay.
All right. So interns are PGY 1s. And so what they do in the hospital is basic evaluations. They write orders for floor patients. They are in the OR if they're surgical residents. They may be doing surgery, but they're always going to be supervised, and someone's going to be like actually, watching them.
Yeah.
Yeah, they're going to be watching them like a hawk.
Mm-hmm.
Interns are not doing surgeries by themselves. Now, could they be sewing you up in the ER? Yeah, absolutely. I mean, they may be doing simple procedures. But no interns are going to be doing anything of major critical importance. They're always going to be answering to residents. So as you go up the level, PGY2s, generally PGY2s, there's a steep learning curve in medicine, so PGY2s often help run ICUs. And that may have changed a little bit. When I was a resident, PGY2s always ran the ICUs. I mean, because of work hour restrictions, that may have been bumped up a year. But PGY2s are going to be doing more. But in the OR, they're always going to be with another, probably attending, sometimes maybe a chief resident doing cases, but they're not going to be doing anything by themselves of any importance except maybe putting dressings on or maybe closing small incisions.
Right.
Going up to like mid-levels, like PGY3s, like these are going to be, pretty experienced residents at this point. They're going to be taking care of like very critical patients, like maybe trauma patients, like in the ER, doing the initial evaluations for their upper level residents or attendings. They'll be actually doing a lot of surgery in the OR, but it still will be under supervision. They're going to have either a chief resident working with them or a fellow or an attending. And so someone of higher level is going to be watching them. As you go up to like PGY4, I call these baby chiefs because they're considered chief residents, but they're not the highest chief level. They do a lot of supervision. They're not going to be quite doing as much like the grunt work. They'll be doing a lot of surgery. They may be doing stuff with the attending scrubbed out at that point, but they wouldn't probably be doing anything critical. They're going to be doing really routine stuff, nothing out of their scope generally. So when you get up to PGY5, so this is considered a chief resident, at least in general surgery, and in almost all other surgical categories except for something like neurosurgery, which is longer. So PGY5s or chief residents can operate independently. I mean, they can run their own ORs. Now they still
like the word resident kind of firms up what they're allowed to do. It's like that's their hospital now.
Yeah. So and that the reason that resident is the name they called them, because initially when you were a resident, you lived in the hospital. Like that was your residence because it was so intensive that people didn't go home. They lived at the hospital. But yeah, so PGY5s could be operating on you by themselves, and that's very, very common. In fact, when I was a PGY surgery chief at a level 1 trauma center, we did not have attendings in-house and we didn't have fellows in-house, meaning I was like the highest ranking surgeon in the hospital at a level 1 trauma center doing surgery. Now that was a few years back, so I was a chief resident in 2007, so I'm not sure that happens these days, but I guarantee you that there's still PGY5 chief residents operating on their own. Ultimately, the attendings are responsible for them, but they absolutely could be operating on their own, which means that, you could have a resident doctor operating on you. Generally, you would know that because they're going to tell you they're a chief resident, but it does happen. Now, I'm moving on to the next step, which is fellows. So what it means when you're a fellow is that you've completed a residency. Like you've done a residency, but you want to go on for further training. So I did a plastic surgery fellowship. I was already a general surgeon. I had completed it, but I wanted to go on for more training, so I became a fellow. I actually did 2 fellowships. So this could be a PGY6, PGY7, PGY8. So these guys are the ones that were operating on these patients. Most likely that they were PGY7s. Like these are surgeons who have already completely finished a surgery training program, but now they're doing cardiothoracic as a fellowship. So these guys are going to be very well trained.
Yeah.
To have these guys operating by themselves, even on critical stuff,
normal
is not a big deal. Yeah. When I was a PGY6, PGY7 plastic surgery resident, we were doing microsurgery on our own. We were sewing blood vessels together on our own with no attending in the OR. That was 100% normal.
Yeah.
As it would be to have a cardiothoracic fellow doing heart surgery. I mean, we did heart surgeries as PGY5 general surgeries. We did sternotomies, we did thoracotomies for trauma. We weren't doing bypasses, and those are a little bit more complex. But the point I wanted to make is that all of the fear mongering that popped up based on this judgment about unqualified residents operating on people was just not
silly.
Yeah, it's not accurate. I mean,
they sounded like they needed to write an article to scare people.
Well, I mean, yeah, it's a lot.
Looking for something
like
to
fear sells, right?
Yeah.
And so I saw a couple articles that were kind of like focusing on that part as opposed to the actually important part, which is these guys messed up when they were billing and they got slapped for it. And so, and I do think it's important for people to know, when you go into a teaching hospital, what does that mean? Like, obviously medical students are kind of, down towards the bottom. Then you got your residents, but then there's a whole, host of different levels. Then you got the fellows. For the most part, these teaching facilities, especially these days, people are supervised pretty well.
Right.
When I went through, there was not as much supervision, but also residency was different. It was more intense. And, when I was a PGY5, I felt very, very comfortable doing basically anything. So, we were operating on our own, even as PGY5s. And then same thing when I was a 6, 7, and 8.
Yeah.
You know, because you know, I mean, you're talking years and years of training. That's after medical school.
Yeah.
So, but yeah, I just wanted to kind of dig into that because, you know, I see stuff where it's like, oh, this is being sensationalized, and it's, you know, there's already enough, doctors are catching enough flack already. We don't need like untrue things to be said about us to make it worse.
That's pretty wild when you consider that article to like the articles that you found about plastic surgeons that are not like accredited.
I know, right? Yeah, exactly. Like, where's the fear mongering for that? Like, I'm all for fear mongering about like these unqualified. Those are truly unqualified
a
people.
general surgeon doing.
Yeah, doing
like
specialty surgery.
Yeah.
Yeah, it's craziness.
Yeah, or not even being.
Well, that's why we do
certified.
this. I mean, you know, I really do believe that the biggest reason that we do the show is to educate people and try to protect people.
Yeah.
You know, I mean, we don't always talk about topics that maybe protect people, but we do a lot of topics about, hey, this happened. This is what you need to know.
Prevent ignorance. Yeah.
Yeah. Right. I mean, knowledge is power. So,
yeah.
Right, Travis?
Sure.
You've been kind of quiet in there. You okay, buddy?
I am.
Okay. I know you're busy in there. I can see that. All right.